Alright, so I'm going to give Marky his medications. I've already crushed them up in the medicine crusher. Mixed it up with a little bit of water here. So I'm going to take the syringe and tubing, make sure there's everything looks good here. He's not having any drainage, no redness. That's kind of what us nurses do. I'm going to go ahead and put the tube in there and twist it, make sure the two lines match up when you first put it in, and then you twist it to the right. And then I'm going to unclamp it here. Just a little bit of the gas fluids come out, or gas come out, and check to see if there's any return fluid in the tubing. Then I'm going to go ahead and clamp it. Us nurses like to keep track of how much fluid is coming in and going out. So I clamp it back up. I put it in here and I keep track of how much fluid is in here, so that I have an idea of how much to expect to come out for him. And then I kind of shake it up to make sure it all kind of goes in there with the fluid. And then in the mornings I give him his medicine, his feeding as well. So we'll go ahead and I already know that the feeding is 250 milliliters, so that's also something I'm going to keep track of here as well. And then once we're done feeding them here, I'll give them some more water to make sure everything gets flushed down, and I'll keep track of that as well, and I'll note it down in my notes. Finishing up the last part of the feeding here, so once it finishes here, I'll go ahead and clamp it back up again, fill some more water, measuring how much I'm putting in here for my notes, and then I'll go ahead and unclamp and let it go run through here. Also, we want to make sure that he's always sitting up a little bit here, so he doesn't have any reflux going back into his mouth there. Alright, once that's done, I clamp it back up. I go ahead and twist to the left where the two lines, line here and a line there, are matching up, and then I'll pull out. And then we'll go ahead and close the tube, put the cap on here, and then go ahead and he's good to go.